Let's talk about multiple sclerosis. Now, this is something you'll definitely see in your time in nursing school and for sure when you're working as a nurse. So, multiple sclerosis, or MS, is a progressive chronic disease that causes demyelination of the neurons. Now, if you remember from the anatomy lesson, the axons of the neurons are surrounded by this myelin sheath. And the purpose of the myelin sheath is to make the impulses travel smoother and faster. Okay. So with demyelination, the axon is exposed and we lose that myelin sheath. Now we'll look closer at that in just a second. Now, a key point to know about MS is that it is cyclical, which means it comes in waves of remission, which is where they feel great, and exacerbation, which is where it gets worse. So some days they're feeling awesome and other days they can't even get out of bed. Now, it primarily begins between the ages of 20 and 40, and unfortunately, the cause is entirely unknown at this point. So again, remember that the axons are covered with this myelin sheath that helps the impulse travel smoother and faster down the length of the neuron. So, logically speaking, since the myelin sheath is degraded in demyelination and it's exposing that axon, if we lose that myelin sheath, we're going to get impulse transmission that is neither smooth nor fast. Okay. Now, MS affects both sensory and motor neurons. So afferent and efferent neurons are affected by this demyelination in MS. So you're going to have these jumpy or spastic nerve impulses or these super slow lost nerve impulses, both for sensory and things you can feel and touch, but also the movements and the motor movements that they have. So what I want you to do is pause this video for a sec and brainstorm what this would look like in a patient. Okay. So let's look practically at what this looks like in our patients. Remember, there is sensory motor spasticity or slowness. Okay, so it's spastic or might be slow, might be lost. So they're very weak and fatigued because they're losing some of that motor function. We'll see tremors and spastic muscle movements. Again, that's the jumpy spasticity of the nerve impulses. And then we're also going to see bowel and bladder dysfunction as a result of those loss of nerve impulses. Both bowel incontinence, they'll have urinary incontinence. They could also even get constipation because the gut just slows way down because of the lack of nerve impulses. They're also going to have a really significant loss of sensation peripherally. They're going to have decreased sensations of pain, temperature, and touch. And this is really important when we start talking about safety. This ability to sense pain or temperature can lead to a ton of other problems for them. Now, because of the effects on the neurons in the brain and the central nervous system, we could also see visual disturbances like blurry vision or even spots in their vision, as well as emotional instability or mood changes. You can imagine this is already a really difficult disease to live with, but when you start having personality changes or mood changes, it kind of makes it worse for you as well as your family. Now, a lot of people are able to live with this for years, and others just don't last long because their bodies really just can't handle the stress of this. Now, there's no cure for MS, unfortunately, so most of what we do is, in fact, supportive therapy. We'll give analgesics and muscle relaxers as needed. And that just helps to relieve some of the spasticity or the achiness of their joints and muscles. But there are also some behaviors that we can encourage in the patient that are going to help them cope with their condition. We'll encourage them to conserve energy by clustering their activities and providing for periods of rest. That's going to help them conserve what energy they do have, considering they're fatigued. Now, a lot of these patients, the more this disease progresses, they lose some of their independence. So we're going to encourage their independence as long as possible. We're going to help them with bowel and bladder training because we know they have some issues with incontinence. So they're going to set a schedule. They're going to go to the bathroom at the same time every day. They're going to go every 2 hours, whatever it is that they need to do. They're going to give themselves a way to try to avoid these accidents. And then we want to make sure they keep their fluid intake up. A lot of patients, because of this incontinence, they'll actually decrease their fluid intake because they're afraid of having these accidents. They're afraid of going to the bathroom all the time. So we want to make sure that we encourage them to increase their fluids, have that bowel and bladder plan so that they can get the fluids they need without having the issues of the incontinence. Now, the last two that we're going to look at are extremely important because they deal with safety. Remember, we talked that these patients can't really feel pain or temperature well. And so we need to have them regulate the temperature on the water heater. You can actually go to the water heater, turn the max temperature down, because some of these patients can actually sustain significant burns from hot water because they can't tell that it's hot. Same thing with heating pads. They want to make sure they're turning their heating pads on low or medium and not on high. We just don't want them to sustain these burns. And then again, because they have decreased sensation, slowed motor responses, they're actually at high risk for falls. So we want to make sure that we move cords, we remove rugs, and we really give them the best chance to be safe at home and prevent those falls. So priority nursing concepts for a patient with MS are safety, comfort, and coping. Of course, we can't do much about what's going on with the patient's nerves, but we can keep them safe from injury, especially falls and burns like we talked about. We can keep them comfortable, keep them independent, and we can help them find some coping strategies to help them manage their disease. Make sure you check out the care plan attached to this lesson for more details. Now, I love this quote because I really feel like it sums up life with MS so well. It says, MS can be an overwhelming challenge. One day you can feel strong and resilient, but the next day you feel helpless and isolated. Now, this is really frustrating for the patient and their family, but as nurses, we can play a huge role in making this a little bit easier for them. So remember that MS is a progressive and cyclical disease with periods of remission and exacerbation. The nerves are demyelinated, which causes that spastic or slow nerve impulse transmission, and it's both motor and sensory. So we're going to see that sensory motor loss, the sensory motor slowness. We'll see tremors, fatigue, weakness, and that decreased pain and temperature sensation. Plus, remember the bowel and bladder dysfunction that can be really discouraging. We need to encourage independence and help patients learn how to cope with their disease. Many people live with MS for decades and they have a great life, so we can encourage our patients to do the same. Okay, guys, that's it about MS. Let us know if you have any questions. Now go out and be your absolute best selves today. And as always, happy nursing.